Hey everyone, welcome back to CareFlow Academy and our NCLEX series. First, let's go ahead and check in with ourselves. Are you in the right headspace to learn? Do you have the bandwidth to continue? It's perfectly okay to take a break from time to time. If you need a break, don't worry, you can always come back to CareFlow Academy when the time is right. If you are in the right space and mindset, we can go ahead and begin. In our last module, we talked about priority and delegation. Today, we're going to break down one of the most feared question types on the NCLEX. Select all that apply questions. But here's the good news. Select all that apply questions are usually not harder, they just feel harder. And once you learn how to organize your thinking, they become much more manageable. Select all that apply questions can feel overwhelming because multiple answers may be correct. Students often panic because they are afraid of missing answers or selecting too many. That anxiety leads to overthinking, and once panic starts, critical thinking usually decreases. One of the biggest mistakes students make is treating select all that apply like regular multiple choice questions. But these questions are different. Instead of searching for one correct answer, you evaluate each answer individually. Think true or false, safe or unsafe, correct or incorrect. This is the most important mindset shift for select all that apply questions. Do not ask, how many answers should I choose? Instead ask, is this answer correct by itself? Evaluate one option at a time. Slow down, stay systematic, and do not panic. We can still apply the CARE method to select all that apply questions. This keeps our thinking organized even when questions feel overwhelming. First, let's start with our concept. Ask yourself, what type of question is this? Is this a safety question, a priority question, a teaching question, or a knowledge question? Understanding the type of question helps guide your thinking. Next, let's analyze our choices. Look carefully for keywords, safety concerns, and clues hidden in the question. Watch out for absolute wording like always or never. The NCLEX usually rewards safe and flexible thinking. Now we can rule out a few choices. Eliminate any unsafe actions, delayed interventions, or answers unrelated to the question. If an answer could potentially harm the patient, remove it. Finally, let's execute our decision. Evaluate each answer separately. Avoid all or nothing thinking. Some answers may be correct, others may not be, and that's completely okay. All right, let's go ahead and practice. Which interventions are appropriate for a patient at risk for falls? Keep the bed in the lowest position. Encourage independent ambulation without assistance. Keep the call light within reach. Apply non-skid socks. And leave clutter in the room. Let's go ahead and break it down using the CARE method. First, our concept. This is a select all that apply question and a patient safety question. So immediately we should think, what interventions reduce fall risk? Now we can analyze our choices. Keeping the bed low is safe. It reduces injury risk if the patient attempts to get up. Encouraging independent ambulation without assistance is unsafe. A fall risk patient should not ambulate alone. Keeping the call light nearby is safe. It allows the patient to ask for help. Non-skid socks are safe. They improve stability and reduce slipping. Finally, leaving clutter in the room is unsafe, as this increases tripping hazards. Let's go ahead and rule out some choices. We can eliminate B and E. Those increase fall risk rather than reduce it. Finally, let's execute. The correct answers are A, C, and D. All right, let's try that again. The nurse is assigning tasks to the CNA. Which tasks are appropriate to delegate? Assisting a stable patient with bathing. Obtaining vital signs on a stable postoperative patient. teaching a patient how to use an incentive spirometer, feeding a patient with chronic weakness, assessing pain after medication administration, and ambulating a stable patient. Let's break it down systematically. Concept. This is a delegation question, so immediately we should think, does this require assessment, teaching, evaluation, or nursing judgment? Analyze. Let's review our choices one by one. Bathing a stable patient is a routine CNA task. Obtaining vital signs on a stable postoperative patient is also a routine CNA task. Teaching a patient how to use an incentive spirometer requires nursing. Feeding a patient with chronic weakness is a routine CNA task. Assessing pain after medication administration is evaluating the outcome of an intervention. That stays with the nurse. Finally, ambulating a stable patient in the hallway is a routine CNA task. We can now rule out any choices involving assessment, teaching, or evaluation. This would be choices C and E. Finally, we can execute. The correct answers are A, B, D, and F. These tasks are routine, safe, and predictable, making them appropriate for tasks to delegate. All right, one last time. The nurse is caring for a patient receiving opioid pain medication after surgery. Which findings require immediate nursing intervention? A respiratory rate of 8 breaths per minute. Reports of mild nausea after receiving pain medication. Difficulty staying awake during conversation. Reporting pain level decreased from 9 out of 10 to 4 out of 10. New onset confusion. And blood pressure of 82/50. And now we can break the question down. This is a priority and safety question. Immediately think opioid side effects, airway breathing, and circulation. Analyze each choice individually. A respiratory rate of 8 is dangerous. This indicates respiratory depression and compromised breathing. Mild nausea after pain medication is an expected side effect. Difficulty staying awake during conversation may occur with opioids. The patient is still arousable, making this less concerning. Pain decreasing from 9 out of 10 to 4 out of 10 means the medication is working as expected. New onset confusion is concerning. This may indicate neuro changes or worsening hypoxia. And finally, a blood pressure of 82/50 is dangerously low and indicates circulatory compromise. Let's rule out a few choices. Remove the expected or less concerning side effects. This would include B, C, and D. And finally, let's execute our decision. The correct answers are A, E, and F. These findings indicate respiratory compromise, sudden neuro changes, and circulatory instability. If you struggle with select all that apply questions, don't worry, you're not alone. Mistakes with these types of questions are common. Some pitfalls include over-selecting, under-selecting, rushing, and constantly changing answers. Remember, the NCLEX rewards safe reasoning, not perfection. These questions become easier with repetition. The more you practice, the calmer and more confident your thinking becomes. Focus on safety and trust your reasoning. And finally, remind yourself, you are a nurse. Now you only need to show them. Thank you so much for watching Module 4 of CareFlow Academy. In our next module, we're going to talk about NCLEX anxiety, overthinking, and how to stay calm under pressure during exams. Don't forget to take care of yourself, and I'll see you in the next one.